Good morning, good afternoon, good evening, and good night, depending from where you're watching and listening to me around the globe. I am Mbonu Silas. By vocation, I'm a Catholic priest. By profession, I'm a licensed clinical psychologist. In my YouTube therapeutic series on conquering bad habits, I want to continue or do the second part of a video that I have already done on mental health and mental illnesses or disorders. So today I want to talk about mental illnesses or disorders and how to deal with them or handle them. So what is a mental illness or disorder? It is a wide range of mental health conditions that affect our mood, our thought patterns of cognition, our feelings and emotions, and also our behavioral patterns. Okay, these mental illnesses in this book, Diagnosis Statistical Manual of Mental Health Disorders. Yeah, you can see some like schizophrenia spectrum, psychotic disorder, depressive disorder, trauma or stress disorder. You have anxiety disorders. You have neurocognitive disorder. You have dissociative disorder. You have bipolar disorder. Then you have personality disorders. You have sexual paraphilias or disorders. Then you have disorders that are related to substances. Okay, what are the causes of mental illnesses or disorders? There are four factors that can lead to the causes of these disorders. The first factor is biological factor. When a woman is pregnant, if she is exposed to some chemical substances, it may affect the baby in the womb. There can be a malfunctioning of the brain or injury in the brain. It can affect the baby. The second one is hereditary factor. It can be in the family lineage. It can be transferred from your parents, even your grandparents or great grandparents, to you. You can get it. Then you have the sociological factor, the environment where you grew up, excessive workload, your family history, even your marital relationship. Then you also have cultural norms and also religious norms that can affect you mentally. Then you have the last factor, the psychological factor, poor personality formation, poor psychosexual formation or development, or social integration. Okay, what are the signs and symptoms that you have mental illness? First, self-low esteem, distorted self-image, lack of mental energy. You are low, your mood is down, or you have mood swings. You are detached or withdrawn from the society or social activities, withdrawn from friends, even from family. You want to be alone. You're always angry, anxiety, unnecessary fear. You can also have hallucinations or delusions. You can also have suicidal thoughts. You can have even changes in your eating habit and also low sexual activity or appetite, disinterestedness. It is very difficult for you to cope with daily stresses. So there are many symptoms, but I have given you the major ones. Now what are the effects? The effects are three. One is a medical effect. You can have headache. You can have stomach ache. You can have bodily pains if you go need to see a medical doctor. Then socio-economic effect. Treating mental illness or disorder is very costly. In most civilized world, very costly. But in most uncivilized or advanced world, underdeveloped world, because it is shrouded or spiritualized, people can resort to spiritual therapy, religious therapy, prayer houses to get help. Okay. Another effect is psychological effect. You have depressive anxiety and post-traumatic effects. Okay. Is mental illness or disorder curable? Yes. But you have to do the diagnosis in this book. Then you can use what is called MMPR, Minnesota Multifaceted Personality Inventory. Then also you can use subjective, objective, and also projective method for the diagnosis, but only certified and licensed clinical psychologists, mental health practitioners, or psychiatric doctors or medical doctors can do the diagnosis. Then there will be a prognosis, the probability or the possibility of its curability. Is it mild? Is it severe? Is it acute? Is it chronic? What is the percentage of people? What type of therapy can be given? Is it a group or personal therapy? All these things will be involved in the prognosis. Then we now go to the therapy. I'll prefer two types of therapy: preventive therapy and curative therapy. So, what is preventive therapy? They say that prevention is better than cure. That is the best cure. It's better you don't get mental illness, not to talk of about curing it. To preventive therapy, you have to learn some coping skills, good personality formation, learning how to do stress management, and also psycho-realization techniques. Then there are four things you must put in practice. First, pay attention for warning signs and symptoms of mental illnesses. Then get routine medical checkups and also go to your mental health practitioner. Go and get help immediately because delay can be very, very dangerous. Then another thing you're going to do is self-care. Have a good sleeping pattern. Eat balanced diet. Do exercise. When you do it, it also exercise your brain. Find yourself in good environment. Learn how to relax. Learn how to take rest. Learn how to be with people who will add value to your life. Okay, now the curative aspect. I had to combine two approaches: psychopharmacological approach and psychological approach. By psychopharmacological approach, these are medications that can be given to the patient that already have these mental illnesses by a psychiatric doctor, medical doctor, or mental health practitioner that are qualified and licensed to give this medication. They are like antidepressant, psychotic medication, then anti-anxiety medication, and also mood stabilizing medication. Okay, then you go to the psychological therapy. It's what is called psychotherapy, developed by a man called Sigmund Freud. It is a talking therapy will help you to change your negative thought patterns, to do what is called free association, dream analysis, transference, and also what is called catharsis, just clean up and pouring out, so that there will be a new you, a good orientation, and a change in you. Then you have to do what is called cognitive behavioral therapy, developed by a man called Aaron Beck. The way you think determines the way you feel. The way you feel determines the way you behave. So, just like a triangle. So there will be a good alliance, therapeutic alliance between the clinician or the therapist and the client or the patient. Then we'll discover the trauma or the mental illness, and he knows what to do through his experience and also expertise. Then is what is called positive psychology of a man calls Martin Seligman. The aim of positive psychology is for you to be positive here. The aim is happiness. Happiness does not mean you will not have problems, you will not have issues, but you see problems not as problems, but you see them as projects. So it has three pillars. First, the positive emotions in you. Second, the positive traits in you. Just humanistic psychology that deals with your abilities, your strengths. Then the third pillar is the positive institution that you have, your family, your marriage, the place of work, the social, the religious, and also cultural groups where you belong. These are institutions that will help you. Lastly, I talk about what is called autogenous training, developed by a man called Johannes Henry Schultz. It's a deep breathing therapy for relaxation. You inhale oxygen and also you exhale carbon dioxide. When you're doing it, you'll be repeating some phrases, and those phrases will help you for relaxation of your forehead, of your chest, of your arms, and of your legs. So the whole bodily systems that will help you. So when you combine all these approaches, believe you me, you'll be out from mental illnesses or disorders. But the best treatment is prevention. Never you get this mental illness, not to talk about getting a cure. Okay, you can share this video. You can like, you can comment, and also you can subscribe. If you want to contact me, you will see my email on the screen, mbonugona@yahoo.com or mbonugona@gmail.com. In my next video, I will be talking about personality. How to know your personality, who you are, and also personality disorders and how to handle them. It will be an interesting topic to treat. Thanks for listening and watching. God loves you, and so do I.